Hello. So when are we going to be reopening clinic? This is a question that lots of our patients, practitioners and staff alike are asking. Unfortunately, at the moment, it's not a question we have any strict answer to. We are currently in lockdown, and the government has not currently lifted that lockdown. Now, I know that there are mutterings that the Prime Minister might be doing something to lift those, at least something on Sunday to start to ease the restrictions. What they'll be is anyone's guess, certainly from our perspective at the moment. But we will be looking at those. I mean, we are continually monitoring government advice and our own industry body advice, so the osteopathic industry, to ensure that whatever we do, we're going to be adhering to the protocols and guidelines that are set out for us. So in terms of when we are going to be opening, again, we cannot answer that question yet. We want to open as soon as we can, and we will open as soon as we can, as long as we feel it's safe to do so within the guidelines that are set out. Okay, so as soon as we can, we will. But when we do open, whenever that may be, there will be changes in clinic. And again, I cannot at this particular time give any clarity exactly as to what these may be, because we are still trying to basically bottom these out within the industry, and I suppose with government as well, in terms of exactly what it might look like when we reopen. However, we do have ideas, and we are currently drafting plans. So we're busy at the moment trying to draft plans and protocols as to what we will do once we reopen. So I can give some ideas. We are going to be looking much more strictly at hygiene. We were doing that pre-lockdown anyway, with hand sanitisation for all anyone that came within the clinic, and surface sanitisation, wiping and ensuring all the plinths were fully cleaned down after every patient, minimising any objects in clinic, and making sure all surfaces be cleaned regularly. All of those sorts of things are going to still remain, and probably we're going to up those a little bit. So hygiene and sanitisation will be key. Additional measures that we're going to be implementing will be things like social distancing. We will be reducing as far as possible the number of people in clinic at any one time, certainly within the reception area, and we will therefore be requesting that people only bring, if they need a chaperone, if they need someone to come with them, to only bring one person with them. We would seriously encourage people not to bring anyone, but obviously we would always encourage people to bring a chaperone if that is going to make them feel more comfortable in the appointment. We will be staggering appointments. We will possibly be having to ask patients to wait outside or in their car. Those sorts of things. Again, we haven't kind of finalised any of this yet, but this is just the sorts of things that we are thinking. So I just wanted to let you know of the sorts of things we are thinking once we do reopen. And then the other question that is on everyone's lips at the moment, certainly within our industry, is personal protective equipment, PPE. What is it that we're going to be needing, requiring and wearing? Again, we don't actually 100% know this yet. However, that we do feel that there will be some form of PPE that we will need to wear, possibly masks, gloves and aprons, disposable. We are not quite sure about all of this yet. Again, that needs to be clarified. But we will let people know as soon as we can. There also might be the requirement for patients or anyone entering the clinic to wear a mask as well, to reduce the risk of transmission between anyone that's actually in the clinic. Again, we haven't got any clarity on this yet, but these are just the thoughts that we're having. So I thought it would be best to let everyone know the thoughts that we're having on this. So yeah, that's the thoughts we're having at the moment. As soon as we know, or have any idea when we will be reopening, we will absolutely let people know, because we are desperate to get back to work. We are desperate to continue to help people and do all the good work that we do. And I know plenty of our patients are desperate for us to start as well. However, we have to make sure that we do that within the guidelines, and make sure that everyone, our practitioners, our patients and the population at large, is safe if we are going to do so. So keep well, and we will keep you informed.